Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Occlusal adjustment is indicated for this 25-year-old patient because of bruxism and mild pain in the left temporomandibular joint. She has been wearing an occlusal bite plane, which has been adjusted several times during the past 2 months, and she is presently free of pain. The normal centric relation can now be recorded based on complete relaxation of the jaw muscles and ease of manipulation of the mandible. The patient is placed in a comfortable, slightly reclined position with secure support for the head and neck. She is engaged in a relaxing conversation and told to relax her hands and shoulders, breathe slowly through her nose, and open her jaw widely. With the mouth in the wide position, place the thumb on the lower incisors and the forefinger under the chin, so that the mandible can be easily manipulated. Have the patient place the tongue up against the anterior part of the palate. The mandible is then guided into a retruded closure on the stationary hinge path until the maxillary incisors touch the operator's fingernail. If the mandible feels completely relaxed, move the thumb down until the posterior teeth are brought into contact. If some interference or resistance is detected, the procedure is repeated. With thin casting wax between the teeth, the patient is guided into initial contact in centric relation. The plier beaks are oriented to the mesial buccal cusp of the first maxillary molar. This landmark can be related to the tooth contacts. Using carbon paper, the mandible is guided to make occlusal contact in centric relation, and the slide to centric occlusion. Closure of the patient's casts on the articulator mounting demonstrates similar prematurities on the mesial inclines of the lingual cusps of the maxillary first and second bicuspids. Opposing markings are seen at the distal aspect of the buccal cusps on the mandibular bicuspids. The adjustment procedure can be demonstrated on the casts. The mesial inclines of the first and second maxillary bicuspids are reduced. Leave the holding contact marks for centric occlusion. This adjustment will be accomplished in the mouth with a small inverted cone diamond point in a contriangle. The contact areas are reduced in the mouth. The guiding contacts on the mesial inclines of the maxillary bicuspids are removed. The small stone permits good control over the areas to be reduced. Care is exercised to remove only the contact areas that made the mandible slide forward. The adjustment is tested with wax to determine whether the reduction of tooth substance has removed the bicuspids from contact in centric relation. The procedures are repeated on the right side. Premature contacts in centric relation are registered in the green wax. It appears that the first and second bicuspids are making premature contacts in centric relation. Carbon paper is then placed between the teeth, and the mandible is guided into centric relation closure, and subsequently allowed to bite together in centric occlusion. Note the marks on the mesiobuccal incline of the lingual cusps of the maxillary first and second bicuspids. The recording is repeated on the casts using red dental ribbon. The contacts on the mesial buccal inclines of the bicuspid lingual cusps initiated the slide to the centric occlusion stops in the central fossa. The mandibular contacts are on the buccal cusps of the bicuspids. The reductions are made on the mesial buccal incline of the lingual cusps of the maxillary bicuspids. Notice that the holding contacts in the central fossae are left undisturbed. The grinding again is done with a small inverted cone diamond stone. This provides good access both to the central fossae area and to the inclines. The grinding should be done carefully and precisely in order to avoid excessive removal of tooth substance. The size of the stone provides the opportunity to establish freedom at the centric occlusion stop, as well as the removal of the guiding inclines. A centric relation wax record now shows the molars to be in premature contact. Carbon paper registers the centric relation markings and the slide to centric occlusion. The premature contacts are on the mesial aspect of the triangular ridge, the lingual cusp of the first molar, and the mesial aspect of the lingual cusp of the second molar. A centric relation recording of the mounted casts shows the same contacts. The holding contacts in centric occlusion can be seen at the bottom of the central fossa and at the tips of the lingual cusps. The corresponding contact markings are seen on the buccal cusps and the distolingual inclines of the mandibular molars. The adjustment is made on the mesial incline of the lingual cusp of the maxillary second molar, leaving a small stop mark on the cusp tip. Be sure not to disturb the seat of the cusp in the central fossa. The mesial incline of the lingual cusps and the triangular ridge of the maxillary first molar are also reduced. Again, we try to maintain centric occlusion stops in the central fossae. The use of the inverted cone diamond for these adjustments is being demonstrated on the casts. The grinding in the mouth is accomplished in a similar pattern. The adjustment can also be done with a small knife-edged diamond or gemstone in the straight handpiece. The centric relation contacts are then tested with wax on the left side. There is still a premature contact on the lingual cusp of the second molar. The premature contact and the slide are recorded with carbon paper. Heavy marks are shown on the buccal incline of the lingual cusp of the second maxillary molar against the distolingual incline of the mesiobuccal cusp of the mandibular second molar. A test of the mounted casts with red ribbon indicates the same contact pattern seen in the mouth. The markings are evident on the mesiobuccal inclines of the lingual cusp of the second maxillary molar plane and on the distolingual incline of the mesial cusp of the mandibular second molar. This slide is eliminated by reducing the distolingual incline of the mesiobuccal mandibular cusp. The centric stops or holding contacts at the cusp tips and the foci are not touched. Observe the grinding on the distolingual incline of the mesiobuccal cusp of the mandibular second molar. It is important to leave the holding contacts undisturbed. Test to see if the patient still has a slide in centric by guiding the mandible into centric relation, and have the patient squeeze the teeth together. It appears that the slide has been eliminated, leaving a small area of freedom in centric, which allows for a slight anterior-posterior as well as lateral movement on the horizontal plane. Wax is placed over all of the maxillary teeth. The patient is guided into centric relation closure and the teeth tapped together. This wax record demonstrates an equal distribution of contacts on all of the posterior teeth, while there is a lack of contact of the anterior teeth. The patient is asked to bite on wax in an unguided, natural, centric occlusion closure. In this closure, there are contacts on all posterior and anterior teeth. However, the contacts on the posterior teeth are slightly heavier than those on the anterior teeth. When the mandible is guided into occlusal contact in centric relation, the wax record shows no contacts of the anterior teeth. The freedom in centric contacts can be registered by having the patient grind on carbon paper back and forth between centric relation and centric occlusion, and laterally from centric occlusion. Observe that the holding contacts or occlusal stops both in centric relation and centric occlusion are on small flat areas in the central fossa and the cusp tips. The holding contacts in the maxilla are clearly demonstrated. Testing centric relation in the articulator indicates that stable contacts have been maintained both on the cusps and in the foci for all of the posterior teeth. The slight freedom of centric can also be recorded on the mounted casts. Notice that we have a small area where the casts can be moved back and forth between centric relation and centric occlusion in the horizontal plane. The recording with red ribbon demonstrates the long centric or freedom in centric on both the maxillary and mandibular casts. Note that the centric contacts are on flat areas. Closure in centric relation in the articulator also shows lack of contact on the anterior teeth, while the bicuspids are making contact. There should be no feeling of slide, slip, or tripping in the articulator closure. There should be full freedom of centric and no lateral impact in centric closure. The requirements for principles of adjustment of centric, as listed at the beginning of this movie, have thus been fulfilled, both on the articulator and in the mouth.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.